Hi, everybody. Thank you for staying. My name is Michi Eliazi, and I am the Director of Government Affairs with the American Conservative Union. And the panel that we have coming up is on healthcare. And this lurch to the left, it's the cost of socialized medicine and the right way to hold down the cost of healthcare. So I've got three wonderful people, all of whom I know and have worked with in different ways on these issues, and I'm going to throw it off to them. Karen Kerrigan, she is the president of the Small Business and Entrepreneurship Council, and she also helps to lead the Small Business Roundtable. In the middle is Peter Pitts. He is the president and co-founder of the Center for Medicine and the Public Interest, and Peter was also with the FDA as the Associate Commissioner for External Relations between 2002 and 2004. And then on the far end is Dr. Greg Dolan. He is the Associate Professor of Law at University of Baltimore School of Law, and he is also, I'm proud to say, a Senior Fellow with the American Conservative Union Foundation, and he's helped us with a lot of work on not just issues related to healthcare, but many other issues. So I want to open this very important discussion with a quick question for each of you, and I'll let Karen start. If you could just give us a minute or two, what do you see as the most critical issue right now as it relates to healthcare? Got to pick one. Sorry.
Yeah, but that
It's
one,
a
but
panel.
that
It's a
one,
panel.
I know that one leads to others. But obviously, the cost of coverage. I mean, as an organization representing small businesses and entrepreneurs, they're still being hit with high costs. It's undermining the growth of their small businesses in a competitive labor market, where it's really tough to find people. They have to offer health coverage. So they're paying more for less access to health care. So cost really is the number one issue. And that's sort of the short term. Obviously, there's been some good things that have happened since President Trump took office. A lot of good reforms with respect to improving short-term transition plans, improving health reimbursement counts, association health plans that will allow are allowing small businesses to use their numbers as a pool to negotiate for lower costs. But there's some lag time on that, and that's just starting to take hold right now. The big thing with costs as well is that, it undermines entrepreneurship. We've had weak entrepreneurship now over the past 15 years or more, and individuals say, I'm really, really nervous about giving up my health coverage if they're working full-time to start a business, and that's where short-term transition plans will come into play. I guess over the long term, I mean, really the big issue is, what happens, right, in terms of socialized medicine.
We're going to talk about that.
I know, but that is a big issue. I mean, you can really kiss the entrepreneurial ecosystem goodbye in healthy small businesses, because they're going to be the ones, like all of us, paying for such a system if it ever was enacted. So that's it. That's my cost.
Peter?
Firstly, let me say, great socks. Yeah,
Thank you.
There's one overriding issue here that we all need to be aware of, and we've been talking about it all day. The issue with healthcare is options and choices and freedom for American patients and doctors, or Uncle Sam MD and socialized medicine and government rationing. This is really happening, folks. We really have to be aware of it. We have people on both sides of the aisle, largely on the D side, certainly during the presidential debates, willing and able to say you can't go see your own doctor, that, remember, if you like your own insurance, you can keep it. Well, that didn't work out so good. And now they're saying, well, we're just going to take away private insurance altogether for the overwhelming majority of Americans who have it and who like it and for whom it works. Choices don't just mean insurance plans, although that's certainly a large part of it. It means leveling the playing field. If you want to have a government option, I think that's fine as far as I'm concerned, but then let insurance companies recognize the same economy of scale by selling insurance policies across state lines. Give Americans more options, different types of policies. You should be able to choose what you need. Uncle Sam does need to tell you what to do. And choices also mean different types of coverage. You heard earlier from Dan Snyder about health sharing, which is a tremendously important proposition. Look at that brochure on the table. It's not insurance, it's neighbors looking after neighbors. You know, a lot of people where I come from in Manhattan, in New York City, don't think that we can take care of ourselves. They believe that the government needs to do it all. That's not right. It's a huge battle. It means it talks to cost, it talks to access, it talks to quality, and it's happening right now.
Dr. Dolan?
Being last means I get upstaged twice.
They took all your answers, right?
First on socks and then on the cost.
Your socks are nice.
But you know, I agree with Karen that cost is important, but you know, I wouldn't be a law professor if I didn't say something controversial, and here it is. Elizabeth Warren and Bernie Sanders are right. They're right that our drugs cost too much, and they're right that one of the reasons, or one of the comparison points, is Europe. Equally wealthy countries that are paying much less. The problem, though, is that diagnosing a problem is only half the battle. And being a good diagnostician is only half of being a good doctor. If you go to a doctor and he diagnoses you, God forbid, with a heart attack correctly, and then prescribes leeches, you're going to die. And it doesn't matter that he gave you a right diagnosis. And so I'm going to begin with saying that Elizabeth Warren and Bernie Sanders are right that we're paying too much for drugs. They're totally wrong about how to fix it. The reason we're paying too much for drugs, and we are, is because Europe is paying too little, and because they have socialized medicine that require basically government caps as to how much insurance companies can charge. Drugs are expensive to develop. Drugs, even by some of the most conservative, and I don't mean conservative in a political sense, conservative meaning most limited estimates of how much it costs to bring a drug to market, we're talking about, at a minimum, $200–300 million. A much more you know, right, but that's the lowest of the low end. But really, the true estimate, we're talking about over $1 billion to bring a drug to market. But even at that low end, at $200–300 million, that's an enormous investment. And they got to recoup it somewhere. And so if Germany and UK and Japan and other countries say, well, we are only going to let you charge, you know, this little, guess where they're going to recoup it? They're going to recoup it here. And our alternative is basically twofold. Either we follow the European model, which means we're also going to cap prices, which is going to be great for us for today. But that means there's not going to be drugs tomorrow. So we're basically trading very short-term gain for very long-term loss. Or we're going to have to, in our trade negotiations, ask our European partners to basically bear more of a burden, because we are paying twice. American taxpayers are paying for the research. We're the biggest contributors to medical research, and we're paying again for the cost of the drugs. And so the solution, getting back to Senators Warren and Sanders, the solution is not to import more socialism here to bring down the cost, is to export more capitalism there. And so, and I think the president actually agrees with those senators on the problem. But he actually identified a solution that we need trade with Europe, we need trade with Japan, but it needs to be a fair trade where they're not taking advantage of American taxpayer and not basically underpaying their fair share.
I think that's a great point, and we could talk a little bit more about that as we get into it. I do want to start, you know, Karen, at ACU, we lead with the individual. You know, that's our philosophy. We believe that sovereignty resides in the person. And, you know, you deal with individuals every day when you're dealing with small businesses. How are small businesses looking at this issue of socialized medicine as we see different plans coming down the pike and people are evaluating what they're hearing from elected officials who want to literally change the way that businesses are doing business when it comes to healthcare?
They think Washington is crazy right now. Not Washington, I mean the people that are actually proposing these plans are like, how are they going to do that? I mean, government has never done anything like this. Point us to an example where when government runs anything, it does it efficiently and effectively. You know, they're looking at what they were promised under Obamacare, right? In terms of lower costs, more choices, there was a small business tax credit, there are all these things. And what happened under Obamacare only exacerbated all their challenges, both in terms of costs, limited choices, and again, they're paying more and their employees for less access to care. So as they look at these Medicare for All socialized medicine, I mean, number one, taking away all of private insurance and their ability to provide health coverage for them, for their employees, something that they'd want to do to compete in the marketplace. But also, how are they going to do this? I mean, just like everyone else is asking, how are they going to pay this? Government can't do that. So, obviously they think these plans are just totally crazy. But obviously, it scares them to death. If, someone like Warren or Sanders or whoever were elected and move forward with this, because we know who's going to pay for it, right? It's going to be our economy, it's going to be entrepreneurs, it's going to be the rich, small businesses, and it will be devastating, not only to the health and growth of the small business community, but also U.S. entrepreneurship in general. And if you look at anywhere where they've adopted, socialized medicine, you do see that there is weak entrepreneurship in those countries. They're looking to us all the time, well, how do you do it? What is your model? And it's like, well, limited government and giving individuals freedom and access to capital and all those things that are important to the ecosystem for entrepreneurship and small business growth.
Peter, I think you can probably build on that. Obviously, in your line of work, you've dealt with a lot of professionals in the administrative level on this, and you deal with a lot of folks, obviously, in the private sector world at a larger level than small business on this. How do they feel about this idea of the lurch to the left on socialized medicine? And, tell our audience who have worked with state-based officials what you're hearing from folks at these levels, because everybody's plan is the same, and while there's little different parts that are different, it all leads to one outcome, which is government will be making the decisions for everybody, their families, their businesses.
Let me give an example. When I was in government, I helped design the Part D. Dead battery. See, it's the outside world trying to shut down my message. When I was in government, I helped design the Part D drug benefit for seniors within Medicare, and the Democrats said, this is going to fall flat on its face. We're going to use this as an election issue. Senior citizens can't possibly be permitted to make their own choices relative to the insurance plans that they pick for prescription drugs. And they were absolutely wrong. It's one of the most popular programs the government's ever put in place. Now, whether you think it's a good idea or a bad idea, it is based on a partnership between the government and the private sector, and the philosophical concept that people can make their own choices. Everybody up on the podium during the first and second Democratic debates, the 50 of them that were up on the platform, when asked, do you believe that private insurance should go away, they all raised their hands. And then when it polled badly the next day, said, no, I misheard the question. So, have no doubt about it. The people who are running for president on the non-Republican line all believe that none of you are smart enough to make your own choices. That Uncle Sam, MD, has to be the one and only person making decisions for everybody, not your doctor, not your pharmacist, not the people in your local hospital. So relative to small business, or really for any business, what that means is that employees are going to grow continually unhappy. The biggest growing healthcare sector in Europe is private insurance, offered by employees, because it's an important benefit people in Europe want that they don't have under government-run healthcare. So while we are looking to the Europe of 10 years ago, they're looking to the America of today and seeing that our system works better. That's where small business is going, and government needs to listen.
Well, so Greg, I'm going to ask you this last to build on this, but it's funny because you're probably in the camp where you may have the most sympathy, not you yourself, but the people that you deal with as an academic and someone who's been in the field. You see a lot of people who warm to it as a theoretical approach because it sounds nice that we're going to take care of everybody in a way that everybody's going to have the same thing. And yet what people don't understand is the system that we have thrives through competition, through innovation, through the idea that if you create something that nobody else can create, that does something better than what anybody else can do, you will be rewarded and people will actually be saved by what you've created. And yet, that gets ignored. Does it get ignored on the academic side?
Sometimes, I mean, there's some lack of, there's lack of perspective. And look, I get it. You know, I have parents who are at or near retirement age. As they're getting there, they're getting, you know, they have more medical problems. So I get it. That it's not easy to figure out like how you're going to pay for all of this. You know, my dad recently had heart stents put in, and when we got like the top line bill, you know, it was something like $160,000. And my parents, you know, my mother's a doctor, so my parents are actually doing okay, but I don't know if they had $160,000 to pay out of pocket just to write a check. So I get it, it's costly. But nonetheless, I think we all need a little bit of perspective. Just to take, you know, a disease just it's kind of was in the news, and just off the top of my head. When I went to medical school, and I'm not that old, when I went to medical school from 98 to 2001, and then again to finish up from 04 to 05. So in this century, AIDS was a death sentence. We had some drugs that prolonged life a little bit, could really, alleviate suffering. But once, you know, when I was in high school in the early 90s, we had a whole assembly saying that, you know, if you get AIDS, basically be prepared to die in agony. Then by the time I was in medical school, it was like, be prepared to die, but at least it's going to be not as bad. And now, AIDS is a chronic disease, no different from diabetes. People generally, at least in this country, no longer die of AIDS. Okay? They may die from other reasons if they continue using drugs or whatever else, but and that has happened in a span of 20 years. And we are so quick to forget about this. We're like, well, we want what we want now and today. And so by undercutting our innovation, that progress that happened in a span of less than a generation will not happen. And I want to make another point as well, in terms of choices and in terms of, I fully believe choices are important. I think American people can make choices. I think, you know, we make choices in everything else. We make choices with credit cards. We make choices with mortgages. We make choices even with the plans we have now. We make choices within our doctors, et cetera. But as conservatives, I think we also have to believe in personal responsibility. I think when we make those choices, we have to live with them. Part of the problem was that when Americans were essentially offered an HMO plans that were cheaper but had some limits, Americans rebelled. Now, that can be interpreted one of two ways, meaning that Americans will not stand for government insurance because basically it's going to be a giant HMO, and they will not stand for limited choices. But it also has to be looked at that, look, if you sign up for it to save money, you have to accept restrictions that come along with it. It has to be your choice. What do you want? Whether you want to pay more money and fewer restrictions or less money and more restrictions. But you cannot have a system where you pay for less restrictions and then run to the government to basically to vitiate your contract to give you more than what you actually paid for. Americans should have choices, but they should be responsible for those choices as well.
Just a word on personal responsibility. You know, we all do lots of interviews, and at the end of every interview, the reporter always asks me, what's the one thing we can do to fix our healthcare system? And I say, diet and exercise, and they look at me like I'm being preachy. You know, what has become of personal responsibility? The government doesn't feel it's important. The government feels they can dictate everything. If we begin to understand, you know, for ourselves and our families and our communities, what are the options that we can take to help each other be more responsible to lower everybody's costs, you know, whether it's through diet and exercise programs or smoking cessation programs or programs, again, like health sharing that recognize the fact that if you perform well as an individual, you will be rewarded, you know, in that way. That's not part of the conversation. I haven't heard one candidate running for president talking about the need for people to have personal responsibility. They're too busy talking about trying to centralize everything within D.C., which is exactly the opposite, Greg, to your point, of a greater emphasis on personal responsibility.
Yeah, I think it's important to dovetail from that whole question of government wants to do all this to talk about choice, because choice really matters. It's part of the whole debate about what is the responsibility of the government, what is the responsibility of the person, what is the responsibility of the doctor, what is the responsibility of a health insurance company, of a drug manufacturer, et cetera, et cetera. So, you know, Karen, when you're dealing with your membership folks in the small business community, you know, what do they feel about the choices that they have now versus the choices they may have had, oh, I don't know, just a few years ago? You know, how has the landscape changed a little bit for them when it comes to the choices and some of the ways that they're able to have this discussion of healthcare with their employees, with their members, with their businesses?
Well, some of the changes have been recent in terms of the Trump administration. A lot of the regulatory changes that they've made to strengthen and improve health reimbursement accounts, to make some improvements, including more transparency on, you know, short-term limited duration plans, which I call them transition plans, because they really are only meant if you're at a job, you want to start a business, or if you're someone that is working and you want to go, you know, be at home for 6 months because you're having some personal issue, and that's what these plans are meant for. And so, you know, those plans have been strengthened, and also the opportunity to buy health coverage through a larger association pool. And I mean, I'd love to be able to, again, cross-border, a national marketplace for health coverage, and able to, that would, I think, would be terrific, and that's the one big piece that's missing. So there are more choices that are slowly beginning to emerge. There are some in some states who still feel they have no choices, but the market is also creating choices as well. Direct primary care, you know, is a great example of a model. I was just out in Ohio, and I was meeting with, you know, direct primary care shops or small businesses in small towns, and I think that's a terrific model that policy should enable and not, you know, snuff out, where, you know, individuals are buying memberships on a monthly basis, and there's an example of access to affordable health care for the types of things that you need that you may have been paying out of pocket for. I think also technology is being an enabler of choice as well, as, you know, with broadband, with the development of 5G, there's just going to be a lot more things that doctors can do that maybe you can, on a pay-as-you-go basis, or you can use your health savings accounts. But there are some other changes that need to be made in terms of improving HSAs, a national marketplace for health coverage. I still feel that some small businesses feel they are stuck with high costs. But again, we sort of got to let these changes that have just come into be sort of take hold in the marketplace, and I think there will be some more, you know, really a bigger market for those choices.
So I want to shift, and I want to hear from Greg and Peter on this, and Karen, you and I can get into, but there are two things that many people have been talking about publicly when it comes to the drug pricing issue, which you both correctly have discussed as something where a solution should be on the table, but we should have a solution that works, not a solution that solves the problem today and creates more problems tomorrow, which is what we see now. You know, you have things, plans to use foreign pricing in order to match pricing in a way without doing what you're talking about, which is actually leveling and having competitive pricing, whereas it's forced caps. And you have importation, two things which, you know, ACU has talked about, and Greg, I know you have, and I'll have you talk about that, but importation, it's not the right tool because you don't know what you're dealing with. So if you can start talk about that, and then Peter, if you can kind of hit onto the foreign pricing, you know, then we can really see that this is an issue, and if we don't have positive solutions, then again, we're going to see, you know, a remedy today with more problems tomorrow is kind of how I see it.
So on drug importation, certainly counterfeiting is a concern. But in my mind, it's in some sense actually a lower concern because you could have, you know, you could have inspections and you can have other things. But so for me, that's not the concern that is hard to overcome. It's a concern. It should be dealt with if, you know, if we ever were to move down that route. You know, but obviously not all drugs are manufactured in the United States. We import drugs from, you know, Pfizer. No, Pfizer is an American company. Bayer is a German company, right? So we import drugs from Germany, and we're fine. Like most people don't get, you know, they don't die after taking Bayer aspirin. What is a bigger concern is that if we import drugs that are meant for, especially for lower income countries, for Africa, that means we're basically robbing them and condemning those people to death. It's just that simple. We could have pills for HIV, to treat HIV, that are $1 a day, right? That is the price that we charge, or even lower, to African countries. Why? Because that's all they can pay. We can certainly go there and take those pills that are meant for them, buy them at that price, and bring them to the United States. That means, sure, we're going to do better, but that means we're condemning millions of people to death in Africa. We can make that choice. It's not a choice that I would make, but I think that has to be talked about. Oftentimes, drug companies, as does everybody else, engage in differential pricing because they know that, we can pay to subsidize costs for poor people. Now, again, as I said in my opening remarks, I don't think we should subsidize for Germany. I think Germany can afford to pay. I think France can afford to pay. But I'm not sure South Africa can, or Zimbabwe can, or Angola can, or some of the countries in Asia can.
But the goal is that we have to work with those countries. That's the real point.
We have to work with those countries,
Yeah.
and we have to understand
we shouldn't have the government say, you must charge this, because when we start doing that here, we're going to be condemning our own people.
Oh, sure. What I was saying is that it's not necessarily the government, insurance company, drug companies. They sell their drugs, say, in Thailand for lower cost because, look, Thailand is a poor country. They don't have the same standard of living. So in order for them to get any drug, they have to pay less. But if we go in there and say, aha, we can now compete with you on those terms, yeah, we're going to come out a winner. But guess what? Right now, people have planes, people fly, people travel, and it's a global health issue in some sense as well. And so if we're going to have people dying and having disease in that part of the world, eventually chickens will come home to roost as well.
So I guess this is time for my quick commercial. I have a new book out called Common Sense
I
Healthcare
have this
Policy.
book in my office, by the way. It's a great book.
Common Sense Healthcare Policy for Common Sense Americans and Presidential Candidates. And the reason that I call it Common Sense Healthcare Solutions is because you have these soundbite solutions like drug importation and importing foreign price controls. Now, technically, this is what we refer to in the business as bullshit solutions because it works well on the stump. People go, yeah, drugs from Canada, let's do it. Yeah, cheaper drugs from Europe, let's do that. They don't work. The soundbite is, my drugs are too expensive. What people really mean is my copay at the pharmacy is too expensive because relative to pharmaceuticals, the only time Americans really reach into their wallet or their pocketbooks to pay for health care is at the pharmacy. 90% of the drugs Americans use are generic drugs. Generic drugs are cheaper in this country than Europe or Canada. When the President and Speaker Pelosi oddly enough, agree that we should bring in foreign price controls, alarm bells should go off in every one of your brains. Because we're talking about importing price controls on life-saving medicines where the countries that have these price controls don't even provide access to those drugs in their own countries. It does nothing to change the dynamic about the unfairness, as Greg mentioned, of foreign price controls. You don't import somebody's bad behavior to help them change their bad behavior. We have to send the message that it's not acceptable, that research and development costs have to be shared. The most important thing we need to protect, intellectual property, that's where it all comes from, represented by patents, and doctors in this country can't be told they can't prescribe certain medicines. The flip of the coin of socialized medicine, of government price controls, is rationing. You never hear anybody talk about that who believes in one-size-fits-all government solutions. Part of that has to be, it's just math, folks, the rationing of healthcare. And that's a good conversation to have. We need to have it. It's important. Politicians don't like that because it belies simple solutions to complex problems. H.L. Mencken said that for every complex problem, there's a simple solution that's wrong. And that's what you're hearing coming out of these political debates.
Yeah.
So just on rationing, first of all, I completely agree that that's the natural outcome of government-run healthcare or government-run anything. But look, you can't get away from scarcity. There's rationing today, but wealthier people are going to get more. They're going to get better cars. They're going to have bigger houses. They're going to have more healthcare. That's the reality. But as Ronald Reagan said, since I can quote too, Ronald Reagan said, or maybe it was Churchill, said that the virtue of communism is its equal sharing of misery. The failing of capitalism is its unequal sharing of goods. Capitalism is unequal. We're all going to have different things depending on our level of income. But the virtue of capitalism is that the things that rich can afford today, the poor will be able to afford 5 years from now. Okay? Not at the same time, but they will get it. So we're rationing today, but it's going to eventually spread to everyone. Under socialism, it will never get to that 5 years from now.
So Karen, I know you wanted to add a couple things. And
Yeah, just real quickly, obviously in the health insurance marketplace, there's been a big problem, with innovation and competition. I mean, government regulates so heavily at the state and federal level that
they're trying to find more things to regulate.
Yeah, there's
by
just
the way.
really,
They're not-
you have limited space for entrepreneurs, right, to provide solutions in the marketplace. And again, hopefully with some of these change, I mean, direct primary care, is something that's an outlier. And now we have some of these new health insurance packages that hopefully we can get the market going in that arena. But also remember in the whole drug and biopharmaceutical industry, that it's not just big pharma, right? I mean, biopharmaceuticals are dominated by small innovators, small businesses, individuals in labs who are taking big risks to bring these drugs and these ideas to the market. I mean, 57% of biopharmaceutical companies have fewer than 20 employees, 79% have fewer than 100. It already costs so much money, there's so much regulation, they have to raise a lot of capital, $1 billion all this time. So if you're going to start importing price controls or do anything more to regulate that market, you really are going to snuff out the innovation, particularly as it relates to the really small companies, the entrepreneurs, the innovators who are developing these life-saving drugs. And yeah, they might get bought out by big pharmaceutical companies, but you're taking away all the incentives to innovate.
Another crucial point is, talking about, providing broader access to quality health care for Americans. Pharmaceuticals represent, this is a great Thanksgiving talking point, ladies and gentlemen. Pharmaceuticals represent 11.5% of our national healthcare spend. If you read the mainstream media and you watch the debates, you think they represent 80%. Pharmaceuticals keep people out of the hospital. It saves lives. It makes them pay taxes, go to their kids' weddings, all those fabulous things. We need transparency. We need to talk about transparency. Where's the transparency of the $33 billion every year sucked out of our healthcare system by middlemen who provide no healthcare services? The president's blueprint has begun to talk about this. But as you've heard throughout the course of the day with the Congress people on the podium, the special interest groups are just slamming the door on that conversation. So the transparency about where the money goes is a very important part about moving our healthcare system forward.
Just to pick up on that, and I know we're running short on time, but just to pick up on that, again, it goes to transparency and to choice. When any of us goes for any sort of plastic procedure, when we go to, to have, Botox injection or to get, a hair transplant, clearly I haven't gone, right? But even before we go, we can go online or we can pick up the phone and the doctor will tell us it will cost you this much to the penny. Now, he said, look, if you have an allergic reaction, things might have, whatever, right? But you call up a phone, you pick up a phone and say, look, I have a cough, and I'm not quite sure if it's serious. I want to come in and get a chest x-ray done. How much is it going to cost me? They're like, why? Why?
Or why do you even care?
Or why do you even care, right? So, precisely because we don't know how much it's going to cost. We don't shop around. Again, obviously, if you're having a heart attack, if you were in a car accident, you can't shop around before going to the ER. But for lots of things, you can. But we don't because, A, somebody else pays, and as a result, doctors don't, they don't know what they charge, and there's no transparency at all, and therefore there's no choice.
Well, the last thing I want to say is I want to mention that ACU, working along with Karen's group, the Small Business and Entrepreneurship Council, and 25 or 24 other groups, we're working on this coalition against socialized medicine, and we've been talking about, Nancy Pelosi's, discussions about what she wants to do with healthcare and these things that we see. So, we're working on this fight. So any brief, very brief, 20 seconds, here's your last second, discussion on this from each of you, and I'll go ahead and start with Karen. We'll work our way down.
Just really quickly, I think we're winning on this socialized medicine front. And largely the efforts of the coalition and all the groups as well, just to really give people a reality check on how we could do this. And it's great to see the Democrats all backing off the individual elements that are impossible to do. So we are winning on that. I thank ACU's leadership on that. It is making a difference, and we got some work to do, though, to make sure that this just does not take hold. It's a serious issue.
Yep, very educational, and we want to talk to everybody about it. Yes. Yep, Peter?
We are winning. We have to win. Socialized medicine is an existential threat to this country. When people talk to you about free health care, remind them that it results in huge tax increases for individuals and rationing, and all of a sudden people run for cover. So we need to keep up the good work. We need to keep telling the truth.
Doctor?
I would just end with that kind of where I began. We need some perspective, some historical perspective of where we are and where we came from. When I teach a course on healthcare policy, I show my students a graph and comparing the very, very, very top of the British society in about 18th century with the very, very bottom today. The very, very bottom today, and it's British because that's where the research was done. The very, very bottom today has longer life expectancy, they have lower infant mortality, they have lower maternal mortality than the very, very top 100 years ago. And if we understand that it's the capitalism that brought us here, I think everything else follows.
Thank you. Thank you to our panel. Everybody, thank you for listening. And if you have not gotten a lunch yet, please do, but please remain with us. We have a lot of programming coming up. Thanks, everybody.